Hi, I'm Christina and I'll be talking about skin cancer. So what exactly is skin cancer? Well, skin cancer is an abnormal growth of skin cells. It is also the most common type of cancer among light-skinned individuals. Each year, about 1 million people are diagnosed with this cancer. In 85% of these cases, the skin damage leading to the cancer occurs before the age of 18. Every cell in the body has a tightly regulated system that controls its growth, maturity, division, and death. The blueprint of a cell's function lies within the DNA of the cell. When there is damage to the DNA, the cells begin to divide and grow without control. The mass of extra cells may produce a tumor that can be cancerous. So what are the types of skin cancer? Well, there are 3 types: basal cell carcinoma, squamous cell carcinoma, and melanoma. The first one, basal cell carcinoma, is the most common form of skin cancer. It begins in the basal cells, which is a type of cell within the skin that provides new skin cells as old ones die off. It can often appear as a kind of waxy bump, as you can see from these pictures, and it most often occurs on parts of the skin that are exposed to the sun, such as the face and the neck. Some symptoms of basal cell carcinoma are pearly white or waxy bumps with visible blood vessels on the face, ears, or neck. The bump may bleed, develop a crust, and cause scarring. This type of skin cancer may also be mistaken for sore. The second type of skin cancer, squamous cell carcinoma, is a common form of skin cancer that develops in the thin, flat squamous cells that make up the outer layer of the skin. It is a type of non-melanoma skin cancer. It's usually not life-threatening, but left untreated, it can become aggressive and spread to other body parts and grow. Most squamous cell carcinomas result from prolonged exposure to UV radiation from sunlight tanning beds or lamps. So what exactly is skin cancer? Well, skin cancer is an abnormal growth of skin cells. It is also the most common type of cancer among light-skinned individuals. Each year, about 1 million people are diagnosed with this cancer. In 85% of these cases, the skin damage leading to the cancer occurs before the age of 18. Last but not least, the third type of skin cancer is melanoma. Melanoma is less common than the previous 2, but it's also more serious than other types of skin cancer. This type of skin cancer develops in cells that produce melanin, which is the pigment that gives skin its color. Melanoma causes 75% of deaths related to skin cancer because if it's not found early, the chance of this cancer being deadly is pretty high. The primary cause of melanoma is UV exposure crossed with the amount of skin pigmentation that someone has. Melanomas can develop anywhere on your body, even in places that don't really receive much sun, including the soles of your feet, palms of your hands, and fingernail beds. These hidden melanomas are more common in people with darker skin. The first melanoma signs and symptoms often are a change in an existing mole and the development of a new pigmented or unusual looking growth. So there are 5 symptoms that indicate which moles are melanoma. The first sign is asymmetrical shape, such as the moles that look like two different halves. Secondly, look for moles with irregular borders, such as the ones in these first two pictures. Changes in color, an uneven distribution of color, or growths that have many colors is also a big indicator. The fourth sign is diameter, so look for a new growth in a mole larger than 1/4 of an inch. And lastly, look for moles that change over time, such as the one that grows in size or shape and even changes in color. Also pay attention to the ones that itch or bleed, as you can see in some of these pictures. So now that we went over the 3 types of skin cancer, let's go over the causes. Remember that anyone can get skin cancer, but the risk is greater for people who have fair skin that freckles easily. UV radiation from the sun is the main cause of skin cancer. This UV radiation can be from anywhere, such as artificial sources, such as sun lamps or tanning booths. The risk of developing skin cancer is also affected by where someone lives, and can also be affected by family history of skin cancer. However, sun exposure doesn't explain skin cancers that develop on skin not usually exposed to sunlight. This indicates that other factors may contribute to the risk of skin cancer, such as being exposed to toxic substances or having a condition that weakens your immune system. The risk of developing skin cancer is related to lifetime exposure to UV radiation. Most skin cancers appear after age 50, but the sun's damaging effects begin at an even earlier age. Therefore, prevention should start in childhood to prevent skin cancer later in life. Whenever possible, people should avoid exposure to the midday sun, which is usually around 10 a.m. to 3 p.m. Protective clothing such as sun hats and long sleeves can block out the sun's harmful rays. Wearing light-colored clothing can also prevent skin cancer by reflecting UV radiation away from your body. And sunscreens with an SPF of 15 to 30 or higher block out most of the sun's rays. And remember to check your skin regularly and report any significant changes to a doctor. Treatment for skin cancer depends on the size, type, depth, stage, and location of the cancer. Small skin cancers limited to only the surface of the skin may not require as much treatment other than a skin biopsy, which removes the entire growth. Early skin cancers can also be treated by freezing them with liquid nitrogen, and the dead tissue just comes off when it thaws. Surgical removal of cancerous areas are the most common way of treatment. Cancerous tissue and the surrounding margin of healthy skin is cut out, which may leave a lot of scarring depending on how large the cancer is. In chemotherapy, drugs are used to kill cancer cells. For cancers limited to the top layer of the skin, creams or lotions containing anti-cancer agents may be applied directly to the skin. Systemic chemotherapy can be used to treat skin cancer that has spread to other parts of the body already, which may take a while. And lastly, laser therapy uses an intense beam of light to vaporize growth and doesn't cause as much damage to the surrounding tissues. This type of treatment is used for cancers that rarely spread and are confined to the top layer of the skin. And there's also radiation therapy, which uses X-rays to destroy the cancer cells in a specific spot. The rays are applied directly to the tumor instead of running through the blood vessels.